Thank you. The presentation I'm about to give is based on a report called Reflections on the Practice of Partnership, which is a report that's been produced by the National Association of People Living with HIV and AIDS Australia, and also in collaboration with our partner in Papua New Guinea, Igat Hope, which stands for I have, or we have, or there is hope. My co-authors are Tim Leach, Annie McPherson and John West Torrey, and John West Torrey is the president of Igat Hope, and I think he's in the room here today, and I want to thank him and other people from Papua New Guinea. Without their efforts in Papua New Guinea, there'd actually be nothing much to report. For people not from this region, Papua New Guinea sits above Australia, and the reason why I chose this map is that you see a big central range going down through a country in which there are over 800 languages and 800 different cultural environments, so that you might get a sense of how managing a disease like HIV is in that environment and how difficult it is to organise across a whole population and nation. Initially, the links between Australian and people living with HIV in Papua New Guinea was through conferences, study tours, informal and opportunistic information exchange by people living with HIV in Australia, like myself, and people in Papua New Guinea who were being diagnosed with HIV around the early 2000s. That then moved to various forms of formal partnership arrangements, and funding supports were coming from the Australian national government. Although we have to recognise that there's quite a difference, of course, in the nature of the epidemic between Papua New Guinea and Australia, in terms of Australia being a low prevalence and Papua New Guinea being a very high prevalence. And also, as I've said, the health system operates quite differently and the treatments context is different. Nevertheless, the idea of HIV-positive peer support remained fundamental to our collaborative work. In 2005 until 2008, the Australian government, under their AusAid program, funded our organisation in Australia to provide support for the nascent and emerging group in Papua New Guinea to build a national organisation to represent people living with HIV, to manage strategic planning, governance, to build support in the provinces. There are 19 provinces in PNG. And to increase the visibility and policy engagement of people living with HIV in PNG. Then there was another stream of funding came on board from the Australian government, and from 2009 to 2012, the forms of support were around developing a constitution for the organisation, expanding the network, getting together people from across the country, working on a stigma index project, developing a treatments advocacy program, and some crisis management at times in terms of the organisational structure. So this is really a reflection on learnings, but it's a reflection on how development and aid programs work, and it's a reflection on how that works in the context of HIV. For an organisation like NAPWA, had to learn about this development context, had to learn to work sensitively in cross-cultural contexts. There were a range of funded and unfunded inputs, and there were personal impacts for people living with HIV in Australia who went to other contexts and were quite challenged by that. The Igat Hope Board and membership in Papua New Guinea had challenges because the group was coming from a demographic which were basically very poor and on very low income, hadn't had the experience in terms of governance or financial management or program delivery and advocacy that had been the experience in Australia. And in Papua New Guinea, there weren't many successful models of civil society organisations on which to draw, and the reality still is that members were sick with HIV/AIDS, TB and malaria. One of the other learnings that we had was this idea of remuneration and how money is understood in particular countries and contexts. So there was a high level of need from members in Papua New Guinea and an expectation about the organisation delivering welfare support rather than being an advocacy effort. There was also another complication because the large international agencies at the time, WHO and others, were paying high per diem rates for HIV-positive people to engage in activities, and this caused a deal of confusion at times. And nevertheless, the notion of peer links in this kind of work remains important. And what also emerged at many times over this 10-year project was the HIV status of boards and staff. It's a complicated issue, but not irreconcilable. And quite often on the project, there were people who were not HIV positive, who were working in a consultancy arrangement or who were working on the staff of the organisation. But in the context of an environment where people were getting sick and needing help along the way, having both HIV positive and people who were HIV negative was not irreconcilable. On the question of partnership arrangements, it's very generous always to say we are partners in a project, but the reality is that there are always issues of power in any partnership arrangement. And the irony in this situation was that NAPWA in Australia actually held the funds because we were funded by the Australian government to do that. There was also within PNG, the Igat Hope group were often, well, they experienced frustration because some of the local agencies didn't act with confidence that success would be achieved. And in this context, the peer partnership arrangement with NAPWA was very valuable. Ironically, some of the international donors preferred dealing directly with NAPWA rather than the group in Papua New Guinea, despite our efforts to do otherwise, and this undermined the emergence of the positive groups in PNG. Thankfully, though, this has changed over time. The notion of treatments advocacy in a country like Australia takes on a very different form in an environment like Papua New Guinea. We had a couple of treatments advocacy forums in Port Moresby in 2010. Unfortunately, it was impossible to have a plan B for when things didn't go according to plan. For example, in 2010, there was an ARV supply crisis in the whole of Papua New Guinea. So there were factors outside the control of either organisation, making the treatments advocacy efforts very difficult. And in a way, the rollout of antiretroviral therapies in Papua New Guinea has not engaged people living with HIV in the way that community partnership has been understood historically in Australia. And the health of the activists and staff members always remained a challenge. So we conducted a review of the work, and Igat Hope in Papua New Guinea noted that there were good relationships in individual and organisational relationships and visible outcomes. The good advice and valuable technical support helped. Often there was highly valued financial support when that support wasn't available in country. There was assistance to get the Secretariat established and regular mentoring support for Secretariat staff. Apparently simple things like developing an organisational constitution and member network development was appreciated, and there was also help at a practical level with implementing the stigma index research. There were, of course, things that could have been done better. So NAPWA had to negotiate a contract 12 months before we carried out the work. Sometimes that contract couldn't anticipate what was going to happen in country. So in 2010, when the drug supply was stocked out, that of course was a priority, but we hadn't anticipated that in our funding applications. Some Australian approaches simply did not work in PNG. As I mentioned, there are 800 different languages, 800 different cultural arrangements, concepts of leadership, participation are all things to be learned in those cross-cultural contexts. There could have been more investment in building up basic research skills and in documenting projects and evaluating programs. Final notes is a question of where to now in the future, and particularly for my colleagues from Papua New Guinea and friends from Igat Hope. They're now having to work in country with other organisations, and whether that notion of a peer relationship is understood is a big question. With the work by AusAid, with the funding from AusAid no longer supporting the work of NAPWA, who will provide this direct technical support in country for Igat Hope. What we have learnt, though, from a global perspective on PLHIV rights is that the notions of peer support are crucial in any particular environment, and we have learnt lessons with reference to shared values and principles of mutual accountability. A new approach is emerging in Papua New Guinea, where HIV is now being managed within a broader health and health system strengthening approach. And while that goes on, there's still a question arising then of how an organisation like Igat Hope is positioned in that new arrangement, and the need for particular attention still on the experiences of people living with HIV and how they'll continue their work. There is no other organisation like Igat Hope in Papua New Guinea who can communicate with the diverse groups across the country, and the organisation still, 10 years after all the collaborative work that we've done, has still not been able to achieve core funding base from within the country, and that's a real problem. So in conclusion, I've used a quote from a colleague, Elizabeth Reed, who talks about the kind of work we've been trying to do as Journeying With, so that organisations that work on HIV from a values and human rights approach have as their primary focus the physical, social and moral well-being of those they work with. They follow the moral conflicts and systems of structural violence that mark their lives. They journey with them as they endure and resist hardships, discrimination and oppression in their daily lives. They work with them in their quest to create better lives. There's information about the report on that website that I have down there below, and that's the end of my presentation. Thank you for listening.